Nos encontramos en L Aquila, en el Laboratorio Dompé, con el profesor Stefano Bonini, profesor de Oftalmología, director del campus biomédico de la Universidad de Roma. En un principio, hay muchas enfermedades de la córnea.
And right now, in this moment, there's a lot of disease in the cornea. It's finding a lot of disease in cornea. The investigation.
Do you mean generally speaking about
Yes,
corneal
exactly,
disease or
exactly.
keratopathy is quite a common condition. This condition may be due to different, may have different origin. It could be related to infections, degenerative disease, allergic disease, dry eye, and we now are talking of something different, which is a neurotrófic keratitis, and that it affects the nerve endings and may cause damage to the epithelium. So those are keratitis which follow some damage to the nerves. So neurotrófic keratitis are one of the many conditions that may follow to many systemic disease, local disease, for them we still don't have any specific treatment now.
Mm-hmm. La queratitis neurotrófica es una enfermedad rara.
It's a weird disease.
¿Tiene solución?
Have solution?
Yes, it's a rare condition. It may follow, even if it may follow some very common disease, dry eye, such as dry eyes, or systemic, such as diabetes, or such as herpes infections. So, but by itself, it's a rare disease. And there are no solution at the moment, because the solution that we have may not be, of course they're not satisfied even the patients and the doctor. The patients, because to obtain healing, you have to close the eye, or you have to patch it with amniotic membrane, and this is not, of course, it will decrease your visual function.
Usted es uno de los coordinadores del estudio REPARO.
You're one of the coordinators to REPARO.
Defínenos un poco, explique qué es el estudio y qué ha buscado.
It's a study, a clinical trial that's still going on, and it's let's say a phase 2 clinical trial which involves many centers in Europe, and this study look at the 2 different doses of NGF. It's a 56-week study, placebo-controlled, double-masked, and then it looks at the efficacy and safety of NGF in neurotrófic keratitis, in patients with neurotrófic keratitis. Mm-hmm. The results by now, which is not completed, are quite good, and some of these results have been presented this year at the Association for Vision Research in the Arbor meeting in Florida, and which is one of the most relevant meetings of research in ophthalmology. But still, they are not conclusive, so we should wait for the definitive results.
Uh-huh. Las causas de la queratitis neurotrófica, ¿tiene que ver algo con sexo? ¿Afecta más a mujeres, hombres?
No, there are no sex difference. Again, it is related to several conditions. So, maybe that in some disease there is a prevalence, sex prevalence. But if you consider in the wide range. It may follow different conditions. So it's not possible to say man or women at the moment. So I would say no.
Cuando esté el medicamento, el fármaco de Dompé en el mercado, ¿qué gran diferencia puede tener con otros que hacen el tratamiento?
Many differences, because first we don't have a drug now for new drugs for the treatment of such condition, and corneal erosion, Queratitis that not heal, maybe because the abuse of drug, topical eye drops, could be another condition that is quite common. And so we may have something for the treatment of common condition. And if you consider specifically that the eye is and the cornea is very richly innervated, then there is a very strong rationale for the use of this drug. But again, we have to wait to confirm this study.
Gracias al doctor, profesor Stefano Bonini, que los avances continúen.
Gracias.